Haley, thanks. In Tennessee's capital, lawmakers are still deciding whether to get rid of certificates of public advantage. One so-called COPA allowed the creation of Ballad Health's inpatient hospital monopoly.
The Federal Trade Commission warned today getting rid of the COPA could pose a risk to patients.
The COPA allows Ballad Health's monopoly, but also regulates it to ensure the company provides an advantage to customers in Northeast Tennessee. The agreement does not explicitly prevent competition.
The FTC says getting rid of it would not increase competition, but instead remove regulation. Although the state is considering another law that would make it easier for new healthcare companies to set up shop. News Channel 11's Jeff Keeling has been following this story.
He has reaction from lawmakers and experts about the potential change and its consequences. Jeff?
Yeah, Sarah, Casey, to sum it up, views conflict. A couple local lawmakers tell us they believe the change is a step toward competition, something they say their constituents have been calling for, and they say Attorney General oversight will be sufficient. But a Brown University health policy analyst told me if the bulk of the COPA regulations go away before competition is here, consumers could suffer.
Everyone that I spoke with said we've got to get rid of this COPA, we've got to increase competition.
It's not as though repealing the COPA is going to introduce competition. I think that people are confused.
Tennessee State Senator Bobby Harshbarger spoke to us last week, shortly after helping unanimously pass repeal of the Certificate of Public Advantage, or COPA, effective in mid-2028. It would remove a vast array of requirements and restrictions on Ballad Health's monopoly the Department of Health has overseen since they were developed 8 years ago. Something Harshbarger's House colleague Tim Hicks is okay with. Attorney General oversight of some pricing restrictions would remain.
The Attorney General will definitely be in charge of anything that if Ballad gets out of hand in any way.
The Attorney General already has a role. But Brown University health policy professor Aaron Fusay-Brown says the COPA's entire regulatory structure, including the Department of Health role, is what kept the Federal Trade Commission from suing to block the 2018 merger of competing hospital systems Wellmont and Mountain States.
The monopoly was allowed to be acquired in exchange for the COPA's supervision, the state supervision, and that if you take away the supervision, all you have is an unregulated monopoly.
She says the part of the COPA's terms of certification overseen by the Department of Health was put there for a reason.
I would say the bulk of the terms related to issues about healthcare access, quality, and equity. All of that is not really in a traditional bailiwick of an attorney general's office, and none of that would be present without a COPA.
Hicks believes the Department of Health has struggled to enforce the COPA's 100-plus page terms of certification, which specify those regulations.
I'm just not sold that any of that has really been kept up with the way that it should be anyway.
Fusay-Brown says if people think the COPA is not producing results on the healthcare side,
address those shortfalls with a more aggressive posture if they're worried that they're being circumvented, rather than just take them away altogether.
As to restored competition, Harshbarger said,
now that we've removed or we're planning on removing the COPA bubble, FTC has full oversight and it is game on.
Fusay-Brown said despite a required plan of separation, reversing the merger is likely a near impossibility.
We can't undo it. There's nothing to unscramble the egg. There's no way for the FTC to restore the competitive forces that were there prior to the merger.
Harshbarger insists the proposal will benefit citizens and not give Ballad a pass.
There's not going to be a lack of oversight when it comes to this. We are really just trying to do the people's work, increase competition in healthcare, especially in our region. So I think we've been successful at that.
Well, we requested an interview with Ballad to discuss the proposal. The system provided a statement. It said in part that it was appropriate that the legislature determine COPA policy and that the system, quote, has and will continue to advocate for improved access to health care for everyone in our region. We thank our lawmakers for their work on this important health care access issue, end quote. Ballad said it will continue complying with state and federal antitrust law.